Good day everyone. I am Maria Cristine Gurrea, one of the reporter of Natural and Artificial Method of Contraceptions. For anything else, I just want you to give some ideas about contraceptives. Contraceptives are products used to prevent pregnancy by women and men. Each individual has their own choice in what contraceptive they want to use, so you must assess their preference first before providing the best contraceptives for them.
I am Syrach Autentico, and now I am going to talk about artificial contraception. So what is artificial contraception? So from the word contraception, it means to prevent birth. So artificial contraception refers to birth control method that acts on the endocrine system. It is a type of birth control that uses hormones to prevent pregnancy. So di ba naaman tayo natural contraception, so naasad tayo artificial contraception. So natural and artificial contraception is both a method of preventing pregnancy, but unlike natural contraception, artificial contraception, it is a method of preventing pregnancy with the use of medication or physical devices. So there are types of artificial contraception. First, the oral contraceptives. Next, the transdermal patch, vaginal ring, subdermal implant, hormonal injections, intrauterine device, chemical barriers, diaphragm, cervical cup, male condoms, female condoms, and surgical method. So first, we have oral contraceptives. So ang oral contraceptives, I know that many of us is very familiar with this one because it is also called birth control pills. So it contains hormones that block the release of eggs from the ovaries. So mao ni siya ang mga tablitas ngayon na take sa mga girls to prevent pregnancy. It also consists of hormones progestin and estrogen. So there are side effects of oral contraceptives: the nausea, gain weight, breakthrough bleeding, headache, breast tenderness, vaginal infections, mild hypertension, and depression. So, daghan nag-ask kung safe ba mag-take og pills. So, yes, they are safe and reliable for preventing unwanted pregnancy. But if you are breastfeeding age to 35 and above, or if you're smoking, or if you're diabetes, or if you have cardiovascular disease, or hypertension, or cirrhosis, you are not eligible to take the pill. So next, we have transdermal patch. So transdermal patch, it is a patch that attaches to your skin as a way to deliver specific dose of medication. And it has a combination of both estrogen and progesterone in a form of patch. So mao ni siya ang mura ni siya og salon pas og porma bitaw nga ibutang nimo siya sa upper outer arm, upper torso, abdomen, or buttocks. So next, we have the vaginal ring. So vaginal ring, it is a small soft plastic ring that you place inside your vagina for 3 weeks, then remove when the menstrual flow would occur. It releases a continuous dose of the hormones estrogen and progesterone into the bloodstream to prevent pregnancy. So take note that you can continue to have sex as long as the ring is inside, and the vaginal ring has a same effectivity rate as the oral contraceptives, pero ang kalahian lang kay the ring will still works if you have sickness, kanang magsuka-suka ka or diarrhea. So there are side effects of vaginal ring. First is the more vaginal discharge, next the breast tenderness, and lastly the headache. But it is all temporary. And always remember that the woman becomes fertile as soon as the ring is removed. So next, we have the subdermal implant. Subdermal implant involve the delivery of a steroid progestin from polymer capsules or rods under the skin. So these are two rod-like implants embedded under the skin of a woman during her menses or on the 7th day of her menstruation to make sure that she is not pregnant. So ako, I am little familiar with this one since akong ate nakatry og ngani na igibutang nga murag tukog sa ilawom sa iyang arms. And take note that subdermal implant is very effective yun. It has only 1% of fail rate and it is effective for 3 to 5 years. So next is the hormonal injections. Hormonal injections prevent pregnancy by injecting a synthetic version of a hormone progestogen called dipeptidoglyprogesterone acetate or DMPA. The injection inhibits ovulation and causes changes in the endometrium and cervical mucus. So, kaning hormonal injections, it is given once every 12 weeks intramuscularly. So, iyang effectiveness is almost 100%, making it one of the most popular choices of birth control. So, if you try hormonal injections, make sure to have an adequate amount of calcium as there is a risk for decrease of bone mineral density and to engage weight-bearing exercises. So next is the intrauterine device. So for me, this is the most common type of artificial contraception para sa mga mama. We commonly know this as IUD. So IUD is a piece of T-shaped plastic about a size of a quarter that is placed inside the uterus to prevent pregnancy. The device contains progesterone and is effective for 5 to 7 years. So kung nakakaaning IUD, you are advised to check the flow of your menstruation every month and the IUD string and also have a pelvic examination yearly. So next, we have chemical barriers. So it is also known as spermicide. It is a sperm-killing substances available as foams, gels, creams, films, and suppositories. So it is not that effective since it has ideal fall rate of 80%. So next, we have diaphragm. So diaphragm, it is a circular rubber that fits the cervix and should be placed before coitus. A diaphragm is a reusable or silicone cup that covers up the cervix. So, kani siya, i-insert ni siya sa vagina with spermicide before sex to prevent pregnancy. So, it is a device na mag-prevent sa sperm from entering the uterus. And it can be left in place for not more than 24 hours to avoid inflammation or irritation. So next, we have cervical cap. Cervical cap is another barrier method that is made of soft rubber and fitted on the rim of the cervix. It fits over the cervix and blocks sperm from entering the uterus. So, kani siyang cervical cap kay mura ni siya kanang thimble. It is shaped like thimble with thin rim and can stay in place for not more than 24 hours. So next, we have male condoms. So male condoms, so I know that and I am sure that all of us knows already what is this. So male condoms is a latex or synthetic rubber sheath that is placed on the erect penis before vaginal penetration to trap the sperm during ejaculation. So, it can prevent STIs and can be both over the counter without any fitting needed. So, after sexual intercourse, dapat ni siyang tantangon and dispose properly. So next is the female condoms. So kung na male condoms, na po di ay female condoms. So these are also latex rubber sheath that are specially designed for females and pre-lubricated with spermicides. It has an inner ring that covers the cervix and an outer open ring that is placed against vaginal opening. So, after sexual intercourse, dapat sad ni siyang tantangon and dapat i-dispose properly. So, the last one is the surgical method. Surgical method, it is one of the most effective birth control methods. So, the two kinds of surgical methods are used by either the male or the female and would ensure that contraception is inhibited after the surgery for as long as the client lives. So, I've provided a photo of each type of artificial contraception for you to be familiar with it.
Let's start to discuss the first type of natural contraception. First, abstinence. It is simply not having sexual intercourse. If you're abstinent, it means you've decided not to have sex. This includes vaginal, oral, and anal sex. Abstinence prevents pregnancy by not giving the opportunity for semen to enter the vagina, as sperms can't fertilize an egg if you don't have intercourse. And the second is calendar method, also called the Syrach method. This natural method of family planning involves refraining from coitus during the days that the woman is fertile. The calendar method helps you predict your fertile days by tracking the length of your menstrual cycle over several months. So, how do I use the calendar method? So, here's how you do it. First, mark the first day of your period. This is the day 1. Second, then mark the first day of your next period. Third, count the total number of days between the first day of each period. You must chart at least 6 cycles, but charting a few more months is even better. So, take a look at this example. This image shows the number of days in cycle of your period. If all of your cycles are shorter than 27 days, the calendar method won't be accurate for you. Basal body temperature. The basal body temperature is the woman's temperature at rest. Basal body temperature can be used as a way to predict fertility or as a part of method of contraception. By helping you gauge the best days to have or avoid unprotected sex. Tracking your basal body temperature for either fertility or contraception is inexpensive and doesn't have any side effects. And cervical mucus method. This method is also called the Billings ovulation method. The method relies on tracking the changes in a woman's cervical mucus to plan the best days to have or avoid sexual intercourse. This is a slippery, stretchy, egg-white discharge that is excreted by the cervix as estrogen level increases. The slippery nature helps the sperm to survive and swim easily for fertilization. Throughout your cycle, your vagina's discharge changes. It's important to always check the discharges so you'll know when you are ovulating. Symptothermal method is simply a combination of the BBT or basal body temperature method and the cervical mucus method. The woman takes her temperature every morning before getting up and also takes notes of any changes in her cervical mucus every day. In this method, you would need to both manually chart your temperature readings throughout your menstrual cycle while also keeping track of changes and consistency to your discharge or cervical mucus. Ovulation detection. The ovulation detection method is an over-the-counter kit that can predict ovulation through the surge of luteinizing hormone that happens 12 to 24 hours before ovulation. Also called the LH test, is a test that determines a woman's most fertile days by measuring the LH hormones in her urine. The ovulation test should be done daily to detect the highest level of LH. Once detected, sex is advised on the same day and the next day. Lactation amenorrhea method or LAM. LAM is a contraceptive method that can be used when a postpartum woman is intensively breastfeeding. LAM relies on nearly full breastfeeding alone for protection from pregnancy. Coitus interrupt is a contraceptive method whose reliability is questionable, as it is still uncertain today whether or not there are sperm in the preseminal fluid. Moreover, the success of this method also depends on the timely withdrawal of the penis before ejaculation, which may not always be possible.